Genetic mutation has a very important role in lung cancer. Apart from identifying different biological processes in different tumours, we now understand that we can use specific genetic alterations that may be present in a particular patient's cancer.
My name is Bjork, and I'm chairman of the lung cancer advocacy in Sweden, and I'm also a member of the LUCE, the Lung Cancer Europa. I've been a survivor since 12 years, and if I tell somebody that I have got lung cancer diagnosed 12 years ago, still today, within 5 seconds, I got the question, did you smoke? I don't think you should be ashamed of that you've got lung cancer. A lot of people never smoked and got lung cancer.
My name is Christian, I'm from Germany. When I was diagnosed in 2007, I got all therapies that have been available at that time, which was the surgery, the classical chemotherapy and the radiation therapy. Nowadays we have learned much more about mutations, that there are different kinds of cancers, that not every lung cancer is a lung cancer, but there are differences between those. And there's a great hope that this will offer more therapies in future.
Lung cancer is a devastating disease because in more than half the patients it already presents with metastasized, meaning it's already spread out of the lung. So it's really a disease for which we are constantly looking for better ways to treat it, more personalized and effective therapies.
The diagnostic steps that we have to go through when we encounter a patient with lung cancer have changed quite dramatically in recent years. And this has been driven by the availability of an increasing number of new types of drug which are specifically targeted against very specific genetic changes in lung cancer tumor cells.
I think genetic testing is critical. In fact, I'm struck by how many people are not getting it done, and that's something that we have to increase awareness about.
We are seeing more and more patients coming to us and asking questions about mutation testing and these topics. In our association, we encourage our patients to learn more about testings, and we encourage them to talk to the doctors about this.
So I would say if you have non-small cell lung cancer, you should go to a center where they're going to take your tumor and using some test. And there are a number of different options. It can be done at the center itself. It can be sent out to a firm that does it.
The very exciting developments that we have seen in the last 5 to 10 years in lung cancer treatment, and particularly but not exclusively in the treatment of patients with advanced lung cancer, have been very exciting also, not only for patients primarily and for oncologists, but also for pathologists. And the reason for that is that pathological data, pathological information about a patient's disease is becoming more and more important in making treatment decisions for that patient. So from a pathologist's perspective, it's marvelous for my specialty that our input is even more important in the treatment decisions that have to be made for patients, even more important than it used to be in the past.
The best thing I could say to a just diagnosed lung cancer patient is don't give up. There are a lot of good things happening, and so don't give up.